dedicated to empowering you with information,
to make positive choices,
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunetz, and today we're going to be talking about My Brother's Keeper. And my guests are Kim Kleiner, who's Chief of Staff for Mayor James Donchess. She has worked in finance in the private sector for 20 years. Kim has experience in the manufacturing and corporate environment and is Six Sigma certified. Kim joined Mayor James Donchess's team in January of 2016. After Mayor Donchess announced acceptance of the My Brother's Keeper Community Challenge in May of 2016, a challenge issued by President Barack Obama, Kim traveled to the White House to exchange ideas and learn best practices on improving the outcomes of all youth from community members across the country. And she spearheaded the initiative in Nashua, New Hampshire. Along with her today is Barbara Costa, who currently serves as a member on the executive board of the Arlington Community Center. She has worked with the local immigrant and refugee population for a decade, serving as a liaison and advocate for underserved communities while working in different roles throughout New Hampshire. Her focus has been supporting trauma-informed and culturally appropriate practices and policies. Ms. Costa has direct service experience ranging from working with trauma survivors to emerging herself in grassroots, culturally sensitive approaches. Ms. Costa is currently responsible for Lamprey's outreach and community engagement initiatives, tailoring organizational efforts to reflect the community served by the Nashua site, all while supporting different departmental efforts to ensure patient satisfaction and high-quality care. In addition, Mike Carignan is the Deputy Chief of Operations for the Nashua Police Department. He has been a police officer in Nashua for the past 20 years. As a Deputy Chief, he serves as Chairman for Nashua's Community Conversation on Race and Justice. He also serves on the Executive Committee for My Brother's Keeper, Nashua PAL, and the Board of Directors for Marguerite's Place in Nashua. He works closely with Chief Lavoie to continuously strive to improve relationships between the police and Nashua's very diverse community members. Welcome. I'm delighted to have you all here. Kim, let's start with here you went off and represented the city of Nashua in Washington, D.C. to explore what is this My Brother's Keeper. Tell us about that.
So the trip to D.C. Was after we had the summit locally. And the summit locally really brought out the community issues here that were instrumental in going down to Washington and seeing how, okay, now Nashua has these challenges. How are they similar to other communities' challenges, and what did they do? What were some of the initiatives that they brought forth? The summit here locally in May of 2016.
And who was included in that summit?
There were over 70 community partners. So everyone from the police department, to school district, Lamprey Health, to public health, all of our city divisions, Child and Family Services, the Youth Council, PAL, over 70 community partners.
So you all got together with the intent to do what?
To really discuss and focus on what are some of the challenges that we have in Nashua that not sometimes form as barriers or obstacles when we're dealing with our youth and with our families. And how do we collaborate well? Because Nashua does. Nashua collaborates very well. Whether it's the youth council and how they deal with the police department, or the schools and how they deal with the Boys and Girls Club. We collaborate tremendously.
So you took that information from the summit and brought that information to DC
I did.
with the intent of what?
We first sat in regional breakout sessions. So I got the opportunity to speak to individuals from Boston, from Mayor Walsh's My Brother's Keeper, from Providence, getting a feel for, sometimes New England has specific problems that you see regionally, and how did they deal with some of those? And then we talked about what Nashua had identified, and they gave some suggestions on how we move forward. And then in the afternoon of the session was more nationally, and we talked about nationally, what are some of the barriers, especially when you're dealing with racial inequalities, and how do you deal with equity issues. And they brought in a number of national speakers to speak to all of us. And then we got an opportunity to deal and talk with partners, national partners, whether it be mass mentoring or a number of initiatives that President Obama had brought forth. He had a number of key individuals who worked with his My Brother's Keeper program at the White House, and he brought those vendors forth to talk to us and see how they could assist us.
And from attending that, was that the beginning of the outcome of achieving a grant that would allow Nashua, New Hampshire to then be able to be a model of a part of this program?
Well, I think one of the challenges for Nashua is that the program didn't start, My Brother's Keeper didn't start until Mayor Donchess came into office.
So this was one of his priorities, and the reason he wanted to do this was what? He had 3 components that he wanted to make sure of.
He did. So President Obama's program lists 6 different. The mayor chose 3 that he felt were important for Nashua, making sure that every child was ready to enter first grade. So preschool is important, and kindergarten, and I think we saw that in the budget that was just passed, putting full-day kindergarten in. The other was making sure that every child can read and compute at grade level by grade 3. And this is also a priority that the Board of Education has identified. So, I mean, we're all working together on the same page on these. And then the third is providing second chances. So they're youth, and we know that youth have challenges, and we all slip up. How do we provide second chances and opportunities for people to move on and to grow and to explore new things?
So did Nashua then determine that the way to do this was to develop a community center in order to meet the needs?
The community center idea came out of the summit. And one of the things that was discussed there is it's how we all collaborate very well together, but we don't have one central place that we can have programs specifically for youth and families, and maybe learn from each other. We have a lot of programming all in individual sectors or individual locations. But how do we, through our programs and with our families, really work together and learn from each other, and so that our families have access to one location where they can get all their needs answered, or at least find out information.
So My Brother's Keeper offered the financial support to help a community center to be developed?
Mayor Donchess actually put forth in his fiscal 2018 budget, with the approval of the Board of Aldermen, the funding to start the center.
So tell us about the center. Where is it?
The center is at 36 Arlington Street, which is right directly in front of Dr. Crisp Elementary School. The reason that that center was chosen was really 2 key. We found out that that's one neighborhood that doesn't have easy access to services. Although we have public transportation, there wasn't a lot of movement across Main Street to where a lot of our city services are located. So that was one factor. The other factor was Dr. Crisp is 82% free and reduced. So we knew there was a lot of need.
Meaning free and reduced lunch is provided.
Correct.
So economically related to the portion of the city and all the diverse areas within the city of Nashua, you chose this particular neighborhood because it could provide the greatest service to the largest number of people in a location.
Correct. That weren't actively getting
Being
services
serviced.
that we saw.
Okay.
And lo and behold, we got lucky. It had a city building that a program had moved out of. The Granite State Ballet had been there for a number of years and rented the building from the city, and they were moving out. So we got lucky in that aspect, so now a building became available.
And not only did you have a building available, you did a phenomenal job of renovations to make a building that was old and in need of repair a beautiful building. Tell us a little bit about what it took to make the Arlington Community Center.
So it was. The building needed quite a bit of repairs. And thankfully, the budget allowed for quite a bit of capital repairs to be done. The building itself has 3 floors. Downstairs is an office area. And that really needed to be completely re-renovated, new carpet, new things of that sort. The first floor that you walk into had 2 rooms, but they were in rough shape. So you had electrical that needed to be upgraded. A computer room was part of the expense that was added. So it has a computer lab that was installed by City IT Department. Most of the repairs were either done by volunteers, board members, and the city maintenance staff, which is a small department. So we're talking our city maintenance department has 3 people, and they were working there around the clock to get some of these upgrades done.
And so you have a 3rd level also.
The 3rd level probably required the least amount of upgrades because the ballet had left a nice ballet flooring, dance flooring that we felt would be better to keep. It provides some padding for if you're doing exercise, yoga, Zumba, or if you're doing dance classes. So we've really left that floor the way that it was, except for some touch-up.
And Lamprey's involvement in the center.
I think we've been involved with the mayor's office from the beginning. Kim had first approached us in a different committee that Mike and I are both part of.
And what's that committee?
The Race and Justice.
You chair.
And it was kind of a no-brainer for us. It's a holistic approach. We know that the social determinants of health, there are a lot of other things and supports that are needed. So for us, it was a perfect marriage, so to speak. So we've been involved. I'm part of the board, very hands-on, and we try to support as much as we can. We also have programming now at the center. And
types of programming?
Behavioral health. So we have workshops for parents and kids to really give parents the toolbox that they need to help their kids in different topics. I think our first one was kids and anxiety. We'll be talking about depression and among other things, and we'll be working really closely with Dr. Crisp to inform the program that we offer at the center. So it's an ongoing collaboration, multi-pronged approach. I'm on the board with all the indirect stuff, and we also have hands-on, and we'll have somebody there on a weekly basis providing free services to the workshops, and we hope to eventually collaborate and be more hands-on at the school. We'll see how that goes. It's a long process. We're just starting out, but I think that for us, we will try to support in different levels. A lot of the kids that come to our center are from that neighborhood, so we see them for their checkups, and some might be needing some vaccinations. Yep.
Vaccinations.
Vaccinations, and we'll also try to be as present as we can at the center and see what we can offer or how we could best facilitate that relationship and make it easier for parents and kids to be up to date on everything that they need.
It's wonderful. And the role of the police being involved in this, and especially you're chairing this committee together, you're involved in that, and that's how you met, and you all connected. And obviously from everything that you've seen through that committee, this was a natural next step in offering something substantial that could make a difference in a particular neighborhood and reach out. So what did the police do, and what have you done in this whole process?
Well, the police department has an obvious interest in reducing violence and providing second chances for kids, which is what the pillar that we most support. As an agency, the National Police Department, we spend a lot of time outreach to community members, minority groups, just developing relationships with all different groups of people in Nashua. So we understand each other, how each other operates, and we kind of a familiarization. So when the Arlington Street Community Center opened, it was a perfect opportunity for us to just go there, start to get to know people, maybe bring some of the programming from our end that could benefit that community in particular.
Like what?
Well, there's several programs we want to get in. One is a RAD defense, rape and aggression defense class, and we'd like to offer it in a multitude of different languages to kind of support the community down there. Mm-hmm. We are hoping to get some domestic violence educational programs down there. And Kim talks a lot about collaboration, and several members of the National Police Department, we work hand in hand with the same nurses over at the Med Center or Bridges, different domestic violence groups. So if we can all develop programming that can get outreach to that neighborhood, and particularly relating to the community center, it'll benefit us as far as making sure they know the services they can get to so they're not victims of violence, making sure that the kids understand what's available to them so they're not victims of violence, or they know who to go to get some help. And then they trust the police department. We want them to see police officers and say, okay, this is not all bad. This is not, I'm not seeing them all in a negative light. So those are what we hope to achieve out of it. And as far as providing second chances, we want these kids to have an opportunity that if they do make a mistake with cigarettes or alcohol or something, we get them the resources they need so they don't make those second chances, don't end up in our system, don't end up with a criminal record for a minor offense. That's something that we can change.
And as far as resources that they need, what has been established to make sure that those resources are available for them?
So the beauty of how this is all working is there's a lot of programs in place that already do the work that we're trying to accomplish.
Within the city?
Correct. So for providing second chances, the Youth Council is the group that we use predominantly to help facilitate our kids. They have an extensive program for alcohol or cigarette abuse. And if a kid, in lieu of getting arrested, can go to the Youth Council, they'll be able to track through their programming and in their counseling sessions and go through the program to not come back into the system.
Will they actually come to the community center to provide their services?
That is a long-term goal that we have to do.
Okay.
It's new. There's a lot of different things that are growing, and we're learning different things. So
Absolutely.
The Youth Council is definitely on board supporting us.
Wonderful.
And we need to work together to figure how best to get to the county.
That's wonderful. What other resources are available and coming into the community center to provide supports as well as services or activities?
So currently, in the December calendar, it just got finalized, and I was surprised with it being newly opened, how full it is.
And it just opened in November.
Right, and so the Boys and Girls Club have 2 youth programs, one geared more to 11 to 13-year-olds, and one more 14 through 17-year-olds. So they're on different evenings. The National Public Library does a children's story time, but then they also offer a STEAM program to teens.
What is that?
STEAM, so it's math, now I'm going to
Science,
forget,
technology.
science, technology,
Education.
arts.
That's wonderful.
And math.
So it's a combination.
Public health has the community services division that does the vaccines and health checks and things of that sort, but they also have environmental health, who goes in and talks about food safety and making sure that how you store your items. And then this afternoon at 3 o'clock, the city welfare department is going in and offering a program on if you need assistance, how you get assistance, what the process is. So programs like that. The YMCA in Nashua is doing a caregivers program, so like a preschool program for moms or caregivers and their children. So activities centered around your young folks with the parents and how they interact and how they learn, how you can provide your children with early education opportunities through different things that you do. They're there Tuesdays and Thursdays from 8 to 10 in the morning.
Is the center open every day of the week, 7 days a week?
Currently, the center is open when there's programming. Our desire is to have the center open from 8 to 8, Monday through Friday, and then on weekends as programming is available.
So how can people learn about the programming to know when to go there? Do they need to sign up? And are programs free or is there a charge?
The programs are free. There has not been sign up required to get into a program. A program may ask you to sign up once you.
And how do people find out about the programs?
The city website.
And what is that, please?
So if you go to nashuanh.gov, you'll find the city website. And under the city website, there's a tab that says community. And Arlington Street Community Center is the first thing that you get to.
And they can go there and see a calendar of all of the different programs.
Yes.
And then they can just show up at that time and on that day.
Correct.
And no charge at all for them.
No charge.
That's excellent.
Now, we will have the center available for other programming. And there's also a form on that website if someone else has a program that they think is going to be valued to the community and they want to bring it into the center. There's also will be, after the new year, some opportunity if someone wants to rent the center. A member of the community is having something. But we wanted to get the community center established before we started rolling out.
And how do you work with Dr. Chris' school?
Wonderfully.
And what is the relationship that's established? Like, do they help get the program information out within the school?
They do.
And are you servicing a population of very little age-wise? What's the age of the whole basis of who you are serving?
So My Brother's Keepers program centers around youth. But to really deliver services to youth, you're dealing with the whole family.
Right. So we're talking babies all the way up through teenagers, then the adults.
But then we want to engage our seniors as well.
Excellent.
Because seniors offer mentoring to
Absolutely.
children, and our youth can learn so much from our seniors. So we're really trying to engage seniors as far as volunteer opportunities. They like to come in and read a story to a group of children. To really establish those relationships between the community as a whole.
That's wonderful. So does Nashua see this as a model that they would like to duplicate and replicate in various parts of the city?
Well, I think we all chuckle a little. So to be honest, it's been a large undertaking. Ideally, yes. If you look at some of your larger cities, they may have multiple centers around. I think the fact that Nashua didn't have a community center for so long, we're really waiting to see where this goes and how it develops. The center's there for all residents, across the city. We want
So
people
you don't
to
have to
stop
just be in that community. You could
Absolutely
be
not.
living in any area of the greater Nashua area and be able to take advantage of the services and programs within this. So if we were to summarize, how would people find out about the programs and the services that you offer at the Arlington Community Center?
So I think the best way is by going to the website. We try to keep that up to date.
And the website again is?
NashuaNH.gov.
And then they'd go right into which component?
Right under community in Arlington Street. It's the first
It's
thing.
right there, and they
comes
can
up.
click on that and immediately see what the programs are. Now, if they didn't, for some reason, have access to computers, would they be learning about it at the school, the Dr. Chris school, so that they would have a calendar? Or is the calendar printed in the newspaper at all through the Telegraph so people could see it? Or how else might they find out if they might not have access to computers?
So, well, if they don't have access, I was going to say, if you have a cell phone and they have Facebook, we're on Facebook.
Okay, that's good to know.
The Dr. Chris school does have calendars.
Right.
Of course, that's one area. I'm not sure how easy it is to access a school during school hours. There's, we try to get it out to the National Public Library, has calendars available.
Wonderful.
Some of the
Yours
partners,
at Lamprey or
yeah,
Powell or Nashua. So
I mean-
there is a great collaboration of communication is what you're saying, and everyone knows what everyone is doing and letting them know about it and supporting this venture in a very positive way.
Yes, I mean the board is comprised
Who's on
of
the
over
board?
13 agencies. So I mean Boys and Girls Club, PAL, the Youth Center, the Adult Learning Center, Public Health, the library, in the YMCA. I'm going to forget people I know, the school district, Sherry Fulton from Dr. Chris, the principal. So
Excellent.
quite a collaborative
So you
group.
really have people that are supporting this and really working to make this a successful venture for the entire city. It's
Very
fantastic. I think you've done a wonderful, wonderful thing for our community, and all of you that have been involved with it should be very, very proud. I thank you very much for all that you do. Until next time.